well body. Now all man busy. Now, set the children say, come and join the Everyone campaign.
Come and join Everyone campaign. Come and join Everyone campaign. Come and join Everyone campaign. Come and join Everyone campaign. Come and join Everyone campaign.
Let me not say, we picking them they die. Oh.
Question now waiting we go do.
Let me not say, we mama then they left bamboo.
Question today now waiting you self go do. Campaign don't come, everyone for come to time. Single one for family man.
Mama, papa, auntie, uncle, brother, sister, cousin, bamboo.
Come and join Everyone campaign. Government they call me say come and join Everyone
Doctor,
campaign.
nurses, even musicians, them say.
Come and join Everyone
Say we
campaign.
mama and we papa them.
Come and join Everyone campaign.
Come
and join Everyone campaign. The vision from now to 2015, everyone is accountable. Under fight picking for die in a team way unacceptable. A picking not for die for sickness way preventable. Now we president in vision, so we all for be with mission. Make the free healthcare succeed. Come rap picking at the drugs indeed. Everyone's responsibility for the human and picking good medical facility. Drugs accessibility. Government.
All right, good morning and welcome to your program this morning when I could get right on we are on YouTube and on Facebook. The song where you actually the hear they've been done actually play this song from the time where they launched the free healthcare, and then we get a target say by 2015 the number of them where they die, the number of women them where they die, where they go born picking for reduce, but today we did inside 2023. Actually, the government and the health partners them don't they tell we say the number of women them where they go die and born picking business don't reduce. Well, we can look how health system talent inside this 2023 since we don't come to the end of this year. Well, we get people who don't join me inside the program. Members say we can normally review paper them where they come out for the day, but because of the done down this na holiday time, we don't get any of the paper them, but yet we get people that we don't join me inside the program for let we discuss different issues them, especially this one we get for do with the health. Till they look at the health system. We get Ibrahim Isaac Mansare, we're a civil society activist that work on health inside the country. He did it inside the program, but actually in line look they connect. So I think it's not connecting audio yet. We make it still the connect. But on the other side, we get the one the way now then they in charge of the well body business na the country, and we get Dr. Peter McJadwa. We they with me inside the program, and they represent the Leone Medical and Dental Association. Good morning, sir, and welcome to the program.
Good morning. It's good having me here.
All right, a blessing for talk to you as well from one side. Okay, and Isaac, please let just make you get this. Okay, good. Isaac don't go for now. I think he will come inside again. He will come inside back. So let me start with you, doctor. Yeah, if I get it right, you know the person where they talk on behalf of the Medical and Dental Council, right? Dental Association. Doctor?
Hello?
Yes, will you get me?
Yes.
I say if I get them right, you know.
You like me the break this now?
Okay, now the network. I say if I get it right, you know the person where you know the PRO for the Israeli Medical and Dental Association, right?
Yes.
Okay, so tell we, health business inside this particular area. How we don't tell it, but before that, let me just give a quick background for let people understand what that exactly they talk about. So when they talk about the availability of health, Then people also win at the Medical and Dental Association. Now then they basically for look at how medical people in the practice, how even the one they win dentists them out in the practice, the one they pull teeth, how things then they go on inside the health system in the country. So and then they for relate as well to the public on different things. Then. So tell me how the health business we don't tell for the year 2023.
So, definitely, as you know, as a nation, we as medical practitioners, there is no news that we number in terms of for more make we do we work effectively. We number no equate to the amount of patient then we foresee. That means say
Doctor, please excuse me.
patient
Ibrahim, sorry,
to doctor
doctor.
issue
Doctor, excuse me, sir.
very
Ibrahim,
hard.
you background noise, now I can mute you for now. When you ready for talk, you unmute them and come inside, okay? But when I reach to you, thank you for you to mute her for now. Sorry, doctor. Continue, sir.
So as I been say, the patient ratio to doctor is very high. That means like one doctor get for work more than the we require for work for able meet the demand of the population. But irrespective of that, as a nation, we don't dey try we best for make sure say at least we offer the best service to we compatriot them even as the Sierra Leoneans there. It's not easy. There has been improvement, especially with some commitment from the government, and they try for do more for make sure say at least thing we are the basic thing we needed for deliver service at the hospitals. Then they yes, definitely we are not there yet 100%, but there have been improvement which then they I can authoritatively say there has been a rehabilitation or somehow refurbishment of some of the government hospitals there. There has been some improvement in terms of delivery of the free health care drugs, especially in the tertiary hospitals there, and also the district hospitals there. So with all these factors there, I must say it easier now than before for let patients access, at least waiting if we get. And now recently, there has also been other policy where the Minister of Health don't put in place. Also, like we try for send as much doctors as possible to the provinces. Not to that be the case before. Before now, we observe maybe a whole province or district where maybe just one or two doctors. But now that is different case. At least now you will able to get like 5 to 6 doctors per district or per province, wey because of now the new doctors dem wey dey don the rotation na the main prefer hospital na kono dey post there na this place na for get more experience in terms of how that then other hospitals na dey visit dey function. So as I start, there has been deliberate effort for make sure say we achieve we target.
All right.
Which is not easy, but we go try our best.
All right. So una actually they get the support of the government, especially in our different.
That's it.
In our different facilities, then.
Hello.
Yes, I say una actually they get the support of the government, so the maximum support of the government, especially in our different facilities, then. All right, the line they broke up. So let's come to you, Ibrahim. Ibrahim, unmute your mic and I will talk quickly. Doctor, you get me? Dr. Mark? A kind of challenging this morning with regards to the network connection from the part. We just hope it's settled for we get this kind of conversation because it's very important for we actually discuss. Doctor, you get me please? If you get me, you might. Alright, doctor, you get me now?
Yeah, he come back, he asked for
yes.
But I don't get you.
Yes, I know. So the question I ask now with regards to the support of the government, una actually to get the maximum support of the government on our different facilities then?
They get you. Definitely, this is a question we like a tricky because of the fact government get
Alright, so we get challenged with regards we guess them. So I'm pretty sure. Ibrahim, please drop you Zoom line. Let I call you now WhatsApp so we go able to talk clearly. Ibrahim, if you get me, leave the Zoom. Thank you. So I prefer we go over to WhatsApp and see what we can get rather than we stay on the Zoom line. Also, we not able to get any better discussion or conversation. But in the meantime, whilst we wait for figure out where then they come inside again, let we the listen still to the song where now the health song where they been do.
Now we president's vision, so we all for be with mission. Let the free healthcare succeed. Come trafficking at the drugs indeed. Everyone's responsibility. Forgive woman and picking good medical facility. Drugs accessibility. Government's responsibility. For make sure say 15% of the country budget go power body business.
Come and join everyone.
Government they call me say
Come and join everyone.
Not nurses, even musicians them say.
Come and join everyone.
say we mama and we papa them.
Come and join everyone.
Said the children said the call we say.
Come and join everyone.
Come on, everybody. Join the everyone campaign. This not for everybody. Come and give support. Hey. Imagine how many women and picking don't die in a salon. Hey, when you see it too sorry. No, you say no to me from me another day. Imagine picking the die from malaria, diarrhea, and even pneumonia. We're preventable. So give support. Said the children say.
Come and join everyone.
Government they call me say
Come and join everyone.
Not nurses, even musicians them say.
Come and join everyone.
say we mama and we papa them.
Come and join everyone.
Said the children said the call we say.
Come and join everyone.
This question it go to you. You. What you go do?
and save the children for tomorrow. Eh.
Yes, let we save the children for tomorrow. The health system we actually get for make sure say we all put we hand together for let go able for reach whose side we want whose side we go say we picking them to go in hospital, we woman them to go in hospital, we mama them to go in hospital, then they go with joy and come back with smile at them face them, but rather they know for the things anytime when they get belay, they want to go born them for the wondering if then they return back or other things them. So this make we all get for put hand together and work for make sure say the health system improve. So I go over to you again. Now we don't get with two guests them again. Now the WhatsApp line. I go to doctor. Yeah, we now the PRO for the Israeli Medical and Dental Association. Doctor, I be they ask you just now. I say if una really they get the maximum support of the government na una different facilities them.
So as I will tell you, definitely person will get the maximum support. Irrespective of who say the work or waiting, because it's maximum support, that means say like even if you are it where you do where the work, you launch will be readily available all that thing and they will also not use their side and it. What I can say, in terms of support, necessary support, the government is trying impact, but definitely we need to get the maximum support we required, because even other sectors there, they get that kind of support than they. So I just feel say like as an association or as medical within, the government get more room like for improvement. So far, they try, but they can do more. Now that I can say.
All right. So the reason why I ask you this question, now the kind of things them, with the emergence of the social media, WhatsApp, to be specific, you see a lot of things that we not been to see before. Not that they not been to happen before, but now we see them and then they're like everywhere. We mean say government for the take action on them things and they. For example, we go see recent video from Bo who say the people away go with them picking them, they lead on a ground, they sleep there for take care of them picking them. So then they go for men sick and then at the end of the day they go return back with other sick them. And for example, we see Cottage Hospital as well. We say a maternity southside they get labor room or outside they will say, delivery room, low level for column. So, doctor them go they complain say they not get catheter, they not get, the basic things them waiting for the use na their side and day. So now that make they ask whether una they get, and you just been don't talk about the free healthcare where they una they try for make sure say people away for access and they able for access them. Now that make they ask about the contribution of government.
So as you rightly say, definitely let's just take them two issues and we don't highlight. So now in the side of like patient they go to hospital, like sign only for Leone and other thing, that's in some facilities, that are true. And this all got to do with the infrastructure. If you know say most of them facilities, the time they were in designer, they were designed for a very small population. But over the time, then population they don't increase to a number that we the facility they're not able hold. So apparently we get a case in there, especially we get during holidays and we get seasonal outbreaks. What I mean seasonal outbreaks, I know say like during rainy seasons, they expect say people will sick more. Naturally they expect say they will get then diarrhea disease there. Naturally they expect say the malaria and all that thing they will do on the eye and all. So they expect more patients in our hospital. So in that case, then because of the infrastructure, this space not adequate and all, so we don't get the infrastructure will be overwhelmed, and even the medical personnel will be overwhelmed. So that can they say, definitely we are not yet there. It just be see like there has been improvement compared to the past. So basically, what the government need for do, and we are now the department make great effort for do is now for increase on the infrastructure. But at the same time, just increase on the infrastructure without increase on the personnel, like no go create a balance. Yeah. So I also feel say the in terms of manpower, training more doctors, encourage more doctors for stay within county, now the way for go. because over the years we don't see a lot of doctors, but because of lack of encouragement in because of lack of basic necessities from the doctor the own part. But come on, way if inside when agree na pasture, definitely it go left. And it go left last a possible study, then the offer and job na any country we know say that job they pay better, that job they get more facility from that job then you know what it's on. But if government can put in place like some policy then we would make, if not compete, but at least come close to some of these things there, then they say your home is your home, people will prefer come back home. Yeah. So now that now they waiting. Then in terms of cottage and the other side, definitely you know say cottage at the Megifa hospital. And cottage definitely free healthcare for picking them for Belle woman and all that thing and they. So sometimes maybe government could also supply the free healthcare with them there, and then in terms of like replenishing or replacing them after some time it will be very slow. So I think they really need for like double and step in that way. They don't need for left only everything done before they can replace her. So whenever you get an influx of patients where like the number exceed within what they expect at a particular moment, they expect most of the time they don't. Then if other people they can inside now for one access then basic thing and they from the hospital, you know the and it's free healthcare definitely. So waiting the mama or whatever the care with the picking or the sick person, then enable get that thing and they because they're not there or they don't supply on time. So it's all about the supply chain and the timing. So I think that are the issue.
All right, so one question I will ask you before I go to the next guest. Okay, we actually don't lose on the line, so I will still continue with you. The same cottage hospital, apart from the basic things, then when are then small things, then you know even the bed, outside woman then they deliver, not been there up to task, not been there in a very good condition, waiting the government on because we see like every other time. The president, the vice president, and other senior officials, they go visit the same hospital where they talk about one of the main referral for born pikin business inside Freetown. You know, they're not able for get stronger one or new one way for able for replace the old one way not aged.
So this question we ask, yes, for me the doctor from my own part. I think say most of the time they nothing that we need for be replaced from time to time. But as rightly say over time, we don't get senior government officials that we don't visit, especially there in their facility and they don't see. Yeah. So I think say like as policymakers.
Oh.
That their own duty than they, yeah. Who will make recommendation? Who will tell them say this not need for be done, but we don't know which are the priority and which area they want focus on. So definitely, I think then at their own side and but I must say most of them them biscuit thing and some of them they not all but majority they don't go out of use and they need for look into it and they for replace them.
Okay, so let me look at this particular thing where they na the internet and please debunk or deny them things there so. Then say in terms of available healthcare and health status, Salone then still they rate Salone as one of the poor country with health system globally. And in as much they say Pekin and the woman them, they die when then they go, for go born or when then they under 5. We know someone don't they talk about this maternal mortality where don't they reduce, but then still they rate we as one of the poorest, in terms of that particular area there.
Definitely, than he just expected, yeah. We are only poorest country in the world. We still get a very fragile health system and all. But the good thing is, as you rightly say, from indications, with maternal mortality don't they reduce over the years and it reduced drastically. What that simply means say there has been improvement. We just need for do more for catch up with other countries there. Yeah. So in terms of accepting, say yes, we health system not be up to that tax and you know within that. And I'm not gonna say yes, I'm not gonna say no, because the honest truth is, as a country, compared to we manpower and the facilities that we are available, I think say we really did try. Yeah, now that I can say.
All right. And this one I can give to Una as the medical practitioner then, yeah. And we know say most of the doctor nurses them where they inside the country and they work because we don't see one or two other. We get a family member, well, where now we all they watch them programs there together, where then they go overseas, then they excel, then they do very well, yeah. But inside the country, we not see much of them. Who side the problem they? Now, una the doctor then get the problem, or now the system now the fight against una professionalism.
So it's better that you come up with this question because as I be saying in the previous statement. We get so many doctors that whenever they go out for go study, because of the performance level, they can offer them even job like the countries outside they go because they don't want to let they get. Nobody will not let good thing, yeah. And anybody will see good thing, they try for make sure say he keep on to himself. You understand? So definitely now this issue is what they get because of greener pasture, because of like we performance level. You know, so don't forget so they work under very hard conditions, yeah. We're going to work on a very tedious, even in the time of studying at medical school. Like now, the world, the last technology-based world. You understand? We study manually. If I keep it on so most of the time what they do, we maybe we some people then, when some countries they don't even need for graduate for able know. We nothing the way we can just from thinking or from aid we able solve that. Whilst most of the other countries they depend on machines, they depend on diagnostic, they depend on that they for able catch up with that day. Even they get doctors them from the so-called America, the so-called England, Germany, where they can salon for come like on rotation for come waiting. Like they admire change because of the kind way they see how would they do things. Just from nowhere, from scratch, they see the kind of thing they do. So definitely considering all these things there, I must say like the main factor is the system now always they fight back at risk. And that's one of the most critical areas then we the government need to look at.
And when you say the system the fight back, that means say una not get the adequate equipment then, the adequate things for work with for una able to provide the kind SO. Ibrahim, please mute the line. Ibrahim, the line really noisy for now.
Yeah.
Okay, so that means they will not actually get the adequate things then at the hospital for able for do now work, and now this now the biggest problem.
Exactly, yeah.
Right.
Not get the adequate facilities then for operate in terms of diagnosis and all that day. So definitely with all the time they we compound everything, they find out say like then they limit on how for give we ultimate best because for the person operate at invest in healthcare, that means you need to get it and they are available. And trust me, if they get time we can perform the miracle. We put it if you say like even we put it the one for go now the bien higher for go sick. We don't get doctors there, we don't come out here, we don't go to the side and they with them excel. And we get situation there where I can have work without any waiting. We get skills that they pull our salon. We they come on a Ghana. Now doctor back na salon now they call for let the able know what they for do for able tackle them cases then they. We get so many instances. But people do not know because in terms of medicine, we always maintain regionalism. We don't get people we don't go to Ghana for go seek medical care and even Senegal. Then they call back doctors that have for able know how they forgot about that thing in there. And whenever we don't engage in discussion and try for waiting solution, we can almost come out for basically waiting we suggest or waiting we they think say that in the
So
problem.
this
That
can we
always
go
stand
for the
out.
first question where I ask you about the commitment of the government, because all of this means say if we get the machine them na the country we are able for those several things them. You know, la all you dey quickly lack out the civil society activist inside. Ibrahim Mansari, please unmute your mic now, and if you then are side noisy, I will please appeal for let you you move from that side and let we get clean discussion. Unmute. You mic mute right now, unmute and log on. Did you get me? Ibrahim, did you get me? You might mute. Alright, so Ibrahim, they struggle with in line in the mic, you know, so we can still go on and discuss, you know, with Doctor. Doctor, you know, we see this thing we don't talk about, so nothing where a lot of people get concerned about, yeah. We see people in the, especially in the provinces, we don't see one or two cases, them upside small picking them foots and the broke. Then they rotting, then they dry for them, they not able to get medical attention, no nothing. Pass then they end up for care and go. We see sick picking, for example, always they take cases and they care and go overseas. And not to say una not get idea of them things and they, but because of the government not they. How una they engage the government on them things there? So because it's like where una not able for do some of them things there, so the but then they come back to una say we not get the professional doctors them for handling things there.
I think so many people are not that it's even if you engage the feed picking CEO when Ishmael Charles, they will tell you most of the kids that they will travel with, we cannot do almost like everything what I mean by that, in terms of diagnosis, in terms of what need for be done and all, when they come in our country and we could already make life very, very easy for the doctors. The only thing they go for now for just let them go perform the surgery or let them go do the intervention. Yeah, but the majority of the cases then they back with the handler. Yeah, we don't even need for travel that. And you always say the one that we travel that the one that we like we not going to do anything at all. We will not get the facility or the technology or the machine or the diagnostic we will need for use for able to solve the problem in the. But majority of them they have been solved in country, and even the one we travel with, we can almost do like everything in terms of diagnosis, in terms of what need for be done, and why they need for travel them for care them go. So I think that side, as I say, we they on top of the game, and as I rightly say, all these jobs boil down to the government inside the commitment. As I say, if you look at things, yes, we are not yet there, and we are far from reaching there, but in terms of at least commitment and trying to make things better, there has been some effort. Yeah, so that I can say.
Alright. So still, Ibrahim, you get we? Right, Ibrahim still there with me. I don't know what's not the problem, but Ibrahim, if you get we, unmute your mic. Doctor, I think this is a very good thing for let we discuss proper one. So, in as much as we talk about the big sick them way we are not able to handle because of the machine them way not available in country, but we can do like 80% of the job before ever the patient then go for let them go do like the surgery and then give them the last part of the treatment before they return back. And when they return back now on a handbag then they can't end because now on a bag for they see them again. But we get some other things them. They say plenty of the sick them, yeah, plenty of the die where people in the die now inside the country, and as a result of things them we're supposed for make them well. Now, as a result of sick them we're supposed for make them well. That is to say, like for example, nutritional deficiencies. That means that for example, them picking them we can say malnourished picking them, and they talk about malaria. You talk about access to clean water. When they talk about pneumonia, when they talk about diarrhea, yeah, anemia, malaria, and dry cough. All of them things there. So now things in this way preventable. It's nothing where supposed for make people not die. So, outside the problem they we make most of we deaths now inside the country, they still there in the hands of them minor things that way people have no need for the die out of.
So as you rightly say, most of the death that will happen is very very much preventable. Yeah. Now we get two aspects of health. Yeah, we get the preventive part of health. We'll get for dealing with public health, and we are they connected to more of the environment and the surrounding and what they happen there. Then we get the curative part of health. What that mean now say where you don't feel for prevent, then you get the sick. Then what you need for be done, you need intervention from the healthcare practitioner. Then we get public health officers, we get clinicians. We like na the more midi. Yeah, we na the hospital we base. The clinicians, we don't get the sick. You go, then the next way they happen. Now for make sure say intervene. After I don't intervene, it try for arrive at a diagnosis and try for treat you. So I think say in terms of public health, there with more need to be done because as you rightly say, there are some diseases in picking there, like the diarrhea disease there, the malnourishment and all that thing and I think that we preventable and it all boils down to access to clean water, access to balanced diet, access to clean environments. So you don't, if you don't get that thing in place, definitely, then what will happen? That thing will go fight back and come down on the picking or even the big person as illness. So I think say we preventive medicine much need for be done in that area because honestly, if you prevent, then the clinic will get less burden. But if you fail for prevent, what will happen is the clinic will get overpowered by the sick. You understand? So definitely, if the clinic gets overpowered by patient there, what will basically happen is that you don't get enough manpower for able to handle the cases. Then, as we more just take an example during the era of COVID, we see that even the best of countries then at the world with the best healthcare system, the America, the France, the England, Italy, we see where there was failure in terms of preventing, where we get more people than we get sick, where they put and they go into the clinic. Definitely no able to handle that because of already they don't overpower either the manpower, they don't overpower the facilities that were available for able for them to get adequate attention and care. So prevention is very very much important in medicine. So now make it need for prevent. Then we for prevent. Then definitely you go need intervention.
Right. So this now out of experience, me on side this now, and maybe I just want to add into this because we find out say right now you get a lot of pepe doctor there. Well, sometimes it can be say now real nurse them really, but then they treat the neighbor them na the area them. Yeah. Now if you call people them and say well, how you do? He say hey me I know well. Then say wetin do you? He say I get malaria. You go do test? No, but now the science they know man na malaria I get. This na one thing. Now, people are afraid for going to hospital because then the thing say it's very much expensive, yeah. But me say self so. I mean they live now around the Fullerton community mountain court, yeah, where I get one nurse where be always they treat me. I find out later say when you even go to the nurse, the expensive parts where you go na Macaulay Street Hospital. Now when you go Macaulay Street Hospital, you they do test, the malaria test, then go for tell you whether na malaria you get or na typhoid you get. And then they can able for give treatment to the best for let you able for suppress that thing there. Whereas the nurse always I know well okay, kala give drip. I know well kala give drip. I know well kala give drip. And everybody now, the major things that now they happen now, they see that malaria or typhoid. Now you don't talk about the water, all of that, and they link back to the big one them where now they're supposed to put things in place. Clean the environment and other things there. So how this thing they affect the rating of the health system, taking into consideration all of them scenario I don't build so.
Yeah, you're perfectly right. Yeah, all this boils down to mentality as a country, as a union as there. Trust me, Salomon believe in Pepe Doctor pass like for Guna Hospital. Saluman, they just say all sick at the country na typhoid or malaria. We don't already get them say typhoid malaria. We don't get no sick they do they call typhoid malaria. If possible go to hospital, in fact, that you the diagnosis, you the doctor. We ask what you do. The first way they say, doctor, I get typhoid malaria. We can be so interesting, yeah. But we when are the really clean doctors, they will know what to do, and you very right when you say now the country almost everybody now doctor. What I mean by that, they basically they find out say like as person signify for be treat himself, and then if you realize say you going to the hospital is more cheaper because if you don't begin to treat yourself, you don't go to nurse, and then that person will go to what you want from now for extort you for get as much money from me as possible. So by the time that you small money you get, because it's no secret that we are a very poor nation, majority of people we them very poor, and not mistaken, acquiring health it's very expensive. Yeah, now I make at the advanced world, person they pull out of in pockets for sick health care because of the expenses. So most people now advanced world you now insurance. Insurance they cover you fully of what you get. So that time the way they treat you, they make sure they treat you holistically because not you get for pay. Now insurance will pay for you. You understand? But we not get down in this part of the world, yeah, na salon. So people they pull out of their pockets, yeah. That person get for member for go eat. He gets in 10-20,000. We get for go eat. Then a can sick. He go now. Waiting in the member now for let go sick one nurse in attention, or even because we don't get no idea about medicine. Then we advise and say do this or do that day. So basically, what happen in some of these cases there, by the time when they catch up, see what you then get, it's more than the typhoid or the malaria where they ask you, it's too late, but I don't pass guy. By the time they go to the hospital, in the doctor, you hands are tied, yeah, because this person don't already overwhelm his system. The disease don't overtake his system because it don't go take all kind of concussion, yeah. So I just feel say we need more public health education, yeah.
So public health charity begins at home, yeah. Before ever,
exactly.
most of the paper doctor they talk about, not for saying that people will not get idea in the health sector. Most of them are nurse. So now it come back to una, yeah.
Exactly.
Waiting una they do for make sure say una sensitize, educate una nurses them say when person meet una say I get this thing, instead of you go begin paper doctor and house, send them to the health facility, let them able for diagnose them. Rather than you go and manage and say later now when doctor go watch and they say not to malaria, not to typhoid, rather than a bigger problem you get.
So what did happen, as I say, all the effect for in living, that's the honest truth. What I mean by this, most of them knows the majority. Now of late now like, now make what that me interview, I tell you see, the government don't try. Because they don't try in the sense that they don't try for give more pin codes to nurses them for let them at least work na hospital. They don't try. In terms of infrastructure, for improving infrastructure, yeah. In terms of at least like encouraging doctors them for more day within country and for make sure say waiting that the business would need, they don't go some of them, even though not all. But we still engage in negotiation for make sure say we reach out for reach, yeah. So most of these people already out there and nurses they don't train, as you say. Now we get community health officers there. We then say they around the list. We don't get access to PIN code. We don't pay. And some of them they volunteer for the hospital. Just don't be honest with yourself. A person they don't volunteer for 2-3 years, if they work without no salary, what do you expect? If you don't fail in living, they don't learn a book. What they do basically, I will make sure say you use the knowledge instead for let get money because at that we all the young for. So I just feel say we need more in terms of like for encouraging healthcare workers there for give them more pin code. We need for improve the salary structure of healthcare professionals there. So then they go help them for at least see a reason why they don't need for do backyard medicine. Definitely there will be no doctor, we not professional doctor, we don't go through 7-8 years of study, they don't do house job for 2 years, they travel specialize. We would practically, most of the time what they now is a person call me say I get this. The first one they say you don't do test because medicine is evidence based. You need just give medication because you want to give medication. You need just go waiting introduce chemical naposing system without you not get easy make introduce that chemical naposing system. In some parts of the world that's a crime. So in terms of professionalism, we doctors will try our best for talk to nurses there. But at the same time, as I say, government get your part for play because if person don't learn a book, a need for be get paid, a need for survive. So most people the way they do this thing, they need for that. But at the same time, the community get a young role for play. Honestly, why make I say the community get a young role for play? Now be owing to the fact say people do not believe even in we the silent doctors there. Trust me, as I be telling you. We don't get cases there where people them for basic thing there. We don't come here. We don't diagnose there. We don't tell us this you get, and this problem will be solved as alone. Instead, they grab, then travel. They go the so-called Ghana, the so-called Senegal. They go tell the same thing. In fact, they end for do nothing. They extort them thousands of dollars. When they come, their conscience they flag them. And because they come and they find the back to they say go see your doctor and you come see. When they come and they confess, doctor I be know and listen to it when I say. Now so thing even when I go under they don't even do any other thing different, but I pay so amount. But if you ask this Salomon say pay me this amount of money for this problem, and they say no, like you know water or you know like Again might pay triple or even quadruple of that money in our other side for the same thing we can forget, including in flight, including other accommodation and other things we need for pay that own skinny. So it just boils down to mentality as Leoneans. Okay. Saloma don't believe in inclusion. Right. If we believe ourselves and believe say we can do whatever they do, me I always say proudly. We don't get cases there, we get evidence. Also, we don't get doctors from salon. We don't grab, we don't go to other countries. We don't go over excel. And when they over excel, they keep there. Because they say, what in the country? They get this kind individual here. So what they do, they offer you better. And what offer you better, you can be tempted for stay.
Yeah,
so and that's what they lost most of
everybody wants to bet in a life. All right.
Exactly. So what
let's come back to quickly. Let's just bring inside. Ibrahim, you get me now? Ibrahim, you hear me? I don't know waiting at the problem. Ibrahim say Mike okay, but we don't try for waiting. And at the same line, he and Doctor they use, but we're not able to get anything from Ibrahim. I don't know if in the area. But I will still advise you for watch your phone, touch the screen and see Mike pop up, and then you touch a Miguel, we see waiting they happen. But I know they anything for you. Or if you use earphone, you could please take them off, but we know they get anything from you. One more time, you hear me, Ibrahim? All right, so let's come back to you, doctor. You know, the issue them now where we get inside the health system, there's plenty. In as much as all of them things are there, but as an association, you know, from where the year begin to this time, una must get a concern where na him una want for ladies government look into waiting at that concern day since now you na the public relations officer.
So I must say, as I'm not doing the last year, we get back and flow with the government, even whether people believe to sit down, strike and all. But at the end of the day, these things are all negotiations. We go into negotiation, they go some photo once, people don't want to get percent. But now, this is not a public domain. If you don't get an agreement like this,
Doctor, please hold on a bit, please. Ibrahim, the get to me?
Yeah, I get you loud and clear, loud and clear.
You get from move from a position because you back down noisy. But you can move from a discussion as a
Alright. I realize the discussion will not be carry on. Now, I don't move a bit.
Alright, so what thing you take as somebody where they look at
Alright, so what do you think as somebody when you look at the with regards first, I want to start for saying we are thank you as producers for this wonderful program, because this program now don't be one of the program when a talk of the town program. So I want to tell you thank you. As you say, me noise to my background too noisy. The reason being because from yesterday when I get this say we get to go online with regards to the health sector. So I decide for Canada the extreme in the western rural area district when I was alone to be specific Koya district. So Canada day and I did at the middle of the street because myself they get one-on-one touch, one-on-one meet with the people. So go back to waiting you try for ask. Waiting the person will just talk about the health sector now this country. For me as a human rights activist, I want to say they tried. Yes, the health sector they try, but for we want to tell them say let them do more. The reason why we want to tell them say let them do more is this. The last time we go at the budget hearing at the
Alright, sorry, Ibrahim in network not okay. Doctor, I mean they ask you a question before we go to Ibrahim. So I'll go back to you quickly and let me talk about that. Ibrahim then at the rural district and the network they give them a very big challenge on that side there. So waiting now una concern, as medical, doctors them.
So as I believe say, definitely we get a contract to go on between we and the government. We don't make a demand on as medical doctors. Government don't do some. Do we need improvements? Definitely. Then I must say, we don't go so far. They try them best for make sure say they keep to the world, to the world. Even though it not they happen to the way we expect them. But as I say, we person they try for do something because now we know the kind of times they will be in. So we being professionals, we try our best for understand their own side. So waiting basically we look for now for make sure say we don't hand over a cohesion paper to the government like a year ago, and now. After the elections, we see definitely now the Ministry of Health, government make the deliberate efforts, like the president, which we must commend them for that day, where he choose two of our colleagues there, one being very, very young colleague, we now one of an outstanding ophthalmologist in the country, Dr. Jelika Mustafa, being Deputy Minister of Health too. Also, he chose Professor Charles Tennessee, a very, very senior colleague of mine, as being the Deputy Minister of Health one. So, like with that kind of transformation in the ministry, and we get now so many clinicians there now the ministry, we believe say definitely they will push on these issues because definitely we get a lot of engagement with them. Now the doors of the ministry more open to with the doctors than compared to before. The bureaucracy will be exist before, not that day again. You can go to the ministry and knock at the door of your colleague and tell her and try to discuss it, especially with the association, and say, well, now this is not the problem, and we try to push them for let them push with it, and they, because the young doctors then demand definitely a very paramount because you go only give out in uttermost best if they work now a condition we favorable to her. So we just feel say especially this year 2024, we expect say if not all, but most of them demand that we don't make. Government go careful look to it because all that they go help for improve the health sector. And as you know, there are a lot of infrastructure projects that are going on. So I feel say with all that thing and the commitment on the government part, but the honest truth is like definitely you know what improve the infrastructure, we not improve the manpower. It's like you building a house and left it unfurnished and nobody know the day. So definitely you know the work that way day. So I think we need for be go by side by side. So both therefore improving on the capacity of the working force and also the infrastructure development, coupled with the deliberate efforts for provide the essential diagnostic there, that will go a long way in making sure say we deal for those out there. The other thing what I feel say very important, we go government for looking to we like to we as young doctors, then that are some of the things there where they make like most people then we they in high place than government, we know they take the healthcare system serious now because of the fact say they know they feel the pinch of what they go on. If government can put in a policy, when a deliberate policy for make sure say if you as a government appointee or you as a government worker, if you get any sick, they only for go pull now the government coffers for give na you hand for go seek medical attention. Other side, you need for go to the government hospital now they forgive clearance say okay this sick here you know the men now this side in it for men. I think say people will make the deliberate effort to make sure say they go to government facilities then and you get more of these people that they facility there than they go create that equity. More not forget say the sustainable development goals where they talk about creating access to healthcare. When at SDG3 they talk about say we forget equity in healthcare delivery. Yeah, so you know mean your status na society. You and that person, when a poor person, we no get anything. Now for the same access to healthcare because healthcare not something wait for B say if I go by status, no.
Okay.
If
So this talk we you try to put in place so now. We even find out say like every year, yes, boku money they come out from the country in COFA in budget, you know, or in consolidated fund. Where then they put, and most of them are ministers, they fumble them, you know, heads of pastors them. Now then they use the money for go out, say then they go take treatment. Yeah, and how this when we see them big money then they can go then go improve other people in the health sector. Whilst una they suffer now, how this they make una they feel?
Now selfishness no more. Not the only way that for discriminating and that's being very selfish, that's being greedy and all. Because they put it because you know me say because you get access to them when they get access to the coffers. So that means say you for take them and go seek something way like you able get an IR. They left that poor man way because of you know get access to her. He left her for letting suffer and die. So I just feel say if government can put in dandy and let it be something when a legislative something, trust me, in no time you will see the where sector will go improve. So I think the civil society organizations, the media, the journalists, and some things that we need for pay attention to and make sure say we popularize that, let people the eye to them and let people then waiting the government for let them pass this policy because definitely just stand like now if I know say if I sick I don't need for go to corner for let any doctor go see me there. Trust me, I not go make any effort to improve corner. If I know say if I sick I not get any see whatsoever I get access to money for travel. If even me eat that or me too hard, the next one I get money for that go. And so these people they do it deliberately. It's like they take vacation. Now vacation, not for even go seek any medical facility. They take vacation, use the money in the name of say the need for go for medical checkup. They go use that and they misuse them. And this like taxpayers' money. I think all these are just greed and selfishness on some of the people that will be in authority, which is very, very bad.
And you're very much correct, because when I look through the audit reports like every year on that particular health sector, on the money where they go spend per health system, you will find out say the audit reports will tell you say some people then take money, they don't even show tickets, show say them fly, they don't even show medical reports, they don't get anything, but then the money then they take and say then they go for medical health, which means you're very much correct on that area there.
Yeah, nothing that we know of, nothing that we they happen, but sometimes we as the doctors, they will not get much to do in that line there. So I think I can tell when I say the media, the civil society, when I can help in that side there and make sure say they get this person this with itself there. If we get policy say okay, the only person we get that free will for travel out of salon for go seek help without waiting. Now the first family, when are the president and a wife and a family, I think that they share enough. But not to any kind.
But even themselves, because now them now the head of the country, even themselves, because we see for example a country like Tanzania, if I get it right, Magufuli, it takes treatment in the country, they go out, and that will show how he value the health system. And again, we see when it take over, it go on all of the health facility them. Who that not they up to the task, then pull them and then put who that they do the business. So yes, it means say they say value the thing. So nobody not for be exceptional if they only for pay attention. Because for God's sake, how you go cook food there, eat it, you go buy cooking on street.
So as I say, so all I left to now, me no go honestly, me no go maybe an employee of the government, maybe a professional doctor. I don't dive too much into issue. I think say that they left to more under the journalists, the owner society, exactly. So we don't go that in that.
Okay, so we there about for make we end now, but I want to ask you one question. But before that, let's try Ibrahim again. Ibrahim, you get me?
Yeah, I get you loud and clear.
I'm able to give you chance for the rest of the program, and we don't come to the end. You listen to this, the doctor, the PRO for Medical and Dental Association. You get any specific thing where you want to say to them?
What me want to try to say here is that we concentrate on the remote sector. Yeah, now the remote sector me, I want to we concentrate. I feel I'm today where like the south I can't find myself today. The network it is scrambled, but I want to pay more attention now the remote areas them. And then this time they get on wait to go on timely supply of this free health medication. You understand me? So we want the Ministry of Health and Sanitation let them pay more attention to the remote side them. Because how you go, as I be say, how you go take a doctor, you go with him Tomo, when that doctor they not get something, we go upkeep him now that place day. So and then two again, and they look at the hygiene sector of hospital then really they out of control. Now if you go Connaught, you go Cottage, every day people they die. Every day people they die. And my brother, I want to take a time. Let this team, let it go go do a thorough investigation. Let me tell you, if you Connaught a Cottage, now, as I tell you so, I like that they infect people them. I like that they infect a patient them. This is something it will be surprising to you for me to tell you that. Yeah? Because the last time my wife was admitted at that hospital because she involved in a fatal accident which I got broke foot. So as they done another hospital, now they want to kill her back for me. The night when we go to that hospital, I'm telling you my brother, 4 So we want the government of Sierra Leone for them pay more attention to the two hospitals and the hospital and the dirty. They dirty to the end of the hospital and the people that die every day. People that die every day. So we are calling on the government. Let me tell you, let the president not say because this will support me, or where have they do me campaign, this can give me 1 billion, or this can give me 200 million. So now Veronica can get this power. Let the president tap in for today, you know, say, you know, the work towards the agenda. Let pull on a power. Who they know say, you know, the work towards that. Let pull on. Let me tell you, we are working for the people. They don't stay away, see that they can't say, that knows don't go, they don't go train at social hospital, they don't go train at social vocational, they vocational there. Now they train there, we not stay away, they not stay, they kill people every day in the hospitals. And then at the western rural area, the kind of incident then, when we they get with regards to this
Ibrahim, they get me. I think you basically they talk about both of them right now, and we will look a time where we'll count the Nurses Association for we can put all of them things there to them and discuss. And unfortunate that we'd actually reach the time and you not be able to get better connection for we talk. But I will beg and I will talk to the producer, let it get you again for coming and see how we can for discuss the nurse them. Since that them you get issue with directly with the way out in the handle the different patients in a different hospital. So I'm very sorry about that and thank you very much.
Alright, thank you very much. Thank you too. Thank you for the program.
Alright. So as a way for just respond to Ibrahim quickly, in 2 minutes before we get you for come and give you final submission, what do you think about what Ibrahim say?
I understand Ibrahim's frustration definitely, and waiting to definitely are so many tools, even not to all, because I think waiting me there against this kind of notice talk now, like attacking the nurses directly, but I just be saying as soon as I say when I engage in the nurses association for let them try for get themselves let them clear the name, yeah, because definitely. In terms of the sanitation at the hospitals there, yes, then I know I agree more with them, but as I be tell you in the beginning, there has been so much improvement that now you go now cannot, I must authoritatively say the kind of way we did before in terms of sanitation, it's you know compare within the last 2 years there has been drastic improvement, but not withstanding. I think one of the things that, especially in this hospital, one of the Arata business campaign, I'm not forgetting most of this hospital like Connaught, it is very close to Bay. Yeah, Connaught is very close to Bay. Yes, then even we look at Cottage. I think inside they close to Bome also, but then they not an area where like the environment of itself not in favor inside the hospital. I don't know how the hospital they are, and right now Connaught are the work. Yeah. And Adoka Cottage. So that's exactly what they say in terms of the sanitation. Before my brother, you know even like for work in the environment then they because you have even your health at risk. Yeah. But there has been deliberate effort for improvement on that thing and I go let Ibrahim meet me, Latika around Connaught, let you show him some of the improvements that will not taking place, the new emergency ward waiting now. When they compare to what we did before. Before the emergency ward was nothing to write to whom about. But now it's really like they feel the patient where they go feel like say okay in our hospital and people we don't go they give that testimony they can put so what I can always say like Connaught too my brother if I be there in any position for waiting Connaught sincerely speaking are they glad one obey away from Connaught in a one like Connaught give me outside day because it only helps if that bay they around Connaught honestly. Because what if I do not Connaught, I'm gonna be a and in Connaught. I don't go about to do not Connaught. Because just imagine now be the actually come out definitely for Canada hospital. And when they Canada hospital, because of the hospital with the waiting day, definitely we not say what the hospital. So one of the solutions there for waiting and Now for clear, I want to be here, if possible, extend them to or not. But there will there be the political will for do that. Because that will for ask yourself. The same for courting. I think most of the things are also near two sides. Not really helps. Yeah, I think one of the way they look into some of these things there, because if not, as the brother saying, sometimes the way you see the after the gym, you know, they be talking a corridor like on the they kick you. But anyway, that's it. Now so it don't day.
All right. Thank you very much, doctor. And so, based on the condition of service as a doctor, medical doctor, and dental surgeon, what do you expect of 2024?
2024, we not make any secrets. We believe say and we expect say the government need to look into that day. They really need to look to her, because we don't want another scenario who say like we go for engage in a back and forth. Because honestly, you being a professional doctor working in Sierra Leone, your salary no commensurate to waiting you deserve in any way or form. So I think they need to look into that day, and we expect much from them. And we patiently wait. They say more patiently. We being professionals, definitely we keep the side of the agreement, and we wait on there for them to keep the side of the agreement. Because if not, then if we are being pushed for going in that direction, then as an association we are always ready.
Thank you very much for taking time for joining me inside the program this morning. For we discuss issues them we get for do with the health sector, and we hope say the one the way concern though actually here. And the biggest appeal where you make today now for all the one the way they take government money for go take treatment outside, except if na sickness where they not there for handle, but then for put a policy way for stop them and let everybody take treatment in the country. That na me take home message. Thank you very much, and I appreciate on the time with we inside the program. Ibrahim, we will try to forget you again in another edition of the program. Well, we begin the PRO for the Sierra Leone Medical and Dental Association, and we now Dr. Peter Mark and Jadwan, and we as well been get Ibrahim I Mansari, we a civil society activist. Thank you very much. We wish you all a very good day and compliment of the season as well. All right.
Thank you.
Yeah, okay, so that's all the program the end today. The producer for this program na Ilya Sabah, and na Indo actually puts together then people here, so we don't come and talk to you about the health system. Now you don't see how the health system talek, and waiting will be the possible solution for the health system. That is true. You know go there you get free health care, or you woman they go born now overseas, and then you say that you in charge of the free health care, you they do very well. You know go there you get health system where they handle, but you same way so don't sick again, you ask if you want to go overseas. That's a very good call, and we just hope and pray that they will do. But unfortunately, I'm not sure say they will be able to do that, because even the parliament way for pass some of them laws there, so they all want money way for make them go overseas for go take treatment. So I don't wonder how they minimum not pay the freedom fighter until then we'll get for meet again. It's another edition of a program where we call we had me to say get on yourself a wonderful day.